Chemosat is a very new, innovative therapy. And the main idea is that we treat the patients with a high dose of chemotherapy in the liver where we have the tumor. And then we take the blood that comes out of the liver and purify it through a filter. So we have less systemic activity of the chemotherapy and with that fewer side effects. At the moment, I think patients which have liver-only disease are good candidates for Chemosat. We do know that patients with ocular melanoma do respond very well to Chemosat if they have liver metastases. At the moment, we do not really have good evidence for metastases from other tumors or primary liver cancer, but this is ongoing trials which evaluate this. We can give high-dose chemotherapy directly to the tumor in the liver. And we filter and purify the blood when the liver comes into the main bloodstream. And with that, we have less chemotherapy in the body and fewer side effects. So this is really an important advantage to systemic therapy. And the other advantage, I think, is that when we do regular chemotherapy, we have to repeat it every week or every other week. With Chemosat, we also have to repeat the treatment. Yeah? But between the treatments, we have time of about 8 to 10, 12 weeks with chemo-free time. At the moment, we cannot really cure patients with chemotherapy, systemic therapy or local therapy. But the idea of chemotherapy in this situation is to really prevent new tumor symptoms or ameliorate symptoms from the tumor that might have already occurred and to control the tumor for a longer time. And with that, of course, to also prolong survival. So with the Chemosat, I mean, it's usually we take the patient in our hospital for the day before the Chemosat. Then the patient will get anesthesia, so he will sleep or she will sleep during the procedure, which takes around 2 to 3 hours. He will get a couple of lines so that we control his vital body functions. And then a catheter is placed in his artery, which delivers the blood to the liver. Then he gets a second catheter, which takes the blood that comes out of the liver in the central venous system. And then once the blood is collected in the veins, it's passed through a filter, and 90–95% of the chemotherapy is filtered out of the blood. And then the purified blood is given back to the patient. And this takes around 2 to 3 hours. And afterwards, the patient will go to an immediate care unit or intermediate care unit where he will stay for the night. And the next day, he can go to the normal ward in general. And after 4 to 5 days, he or she can usually go home. Actually, I think most of our patients really have only a few side effects. One of the main side effects are clearly related to the blood system, the hematotoxicity, so that they have low platelets. But this is something the patient usually doesn't really feel. Yeah? So, of course, side effects can occur, and they occur once in a while. But we can't really say whether there's any predictive marker of more or fewer side effects. It's not really the first or second or third Chemosat. It's not a younger or older patient. So I think every patient per se is a candidate for Chemosat. Yeah? So we do not really have, as long as the tumor is confined to the liver.